What is a hyperplastic polyp in the colon? Imagine a tiny bump or growth inside your colon that is usually harmless. That's often what a hyperplastic polyp is. These are small, non-cancerous growths that form from an overproduction of normal cells lining the colon. They are most often found in the lower part of the colon and the rectum. These polyps are typically pale and small, usually less than half an inch in size. Because they are benign, they rarely cause symptoms and are often discovered during routine colonoscopy exams. Hyperplastic polyps belong to a group called serrated polyps, which have a sawtooth pattern under the microscope. They are the most common type of serrated polyp, making up about 3/4 of all such growths. These polyps develop when normal cells multiply more than usual but without abnormal changes, known as dysplasia. This means they are not precancerous and generally do not pose a threat of turning into cancer. Most hyperplastic polyps are found in the distal colon and rectum, areas where they are considered to have no significant risk of becoming cancerous. However, polyps located on the right side of the colon or the proximal colon may have a very small chance of developing into cancer over time. This is because some of these polyps can be involved in a process that involves DNA repair issues and genetic instability, but this is quite rare and different from the typical hyperplastic polyp. It is important to distinguish hyperplastic polyps from other colon polyps that carry a higher risk of cancer. For example, adenomatous polyps and sessile serrated lesions are considered precancerous and need closer monitoring and removal. When a hyperplastic polyp is found during a colonoscopy, it is usually removed and examined under a microscope to confirm its benign nature. If confirmed as hyperplastic and small, these polyps generally do not requiring aggressive treatment. Still, doctors might recommend routine follow-up colonoscopies based on your age, family history, and other risk factors. Screening plays a vital role in colon health. Regular colonoscopies help detect and remove all types of polyps, including hyperplastic ones, before they can cause problems. Removing polyps early is a key step in reducing the risk of colorectal cancer, which is why routine screening is so important. In summary, a hyperplastic polyp in the colon is a benign growth with a very low chance of becoming cancerous, especially when located in the lower part of the colon. Proper identification and monitoring are essential to tell it apart from other polyps that might pose a higher risk. If you have concerns or a family history of colon issues, talking with your healthcare provider about screening options is always a good idea. Remember, staying informed and proactive about colon health can make a big difference in preventing serious problems later on.